Listen up, because what I'm about to share with you could be the most important information you'll hear about men's health this year. And I'm not exaggerating when I say that millions of men are suffering unnecessarily because they don't know about this one simple vitamin that could change everything. I've seen countless men struggling with prostate issues, taking medications they don't need, and dealing with side effects that make their lives miserable. But here's the truth that's going to blow your mind. There's one vitamin that stands above all the rest when it comes to prostate health, and I'm going to tell you exactly what it is and why it works. The vitamin that changes everything. So what is this miracle vitamin? It's vitamin D3. Now I know what you're thinking. Vitamin D? Really? That's the big secret? But stay with me, because the science behind this is absolutely fascinating, and once you understand how it works, you're going to wonder why nobody told you about this sooner. Here's what makes vitamin D3 so incredibly powerful for prostate health. This vitamin does two critical things that directly impact your prostate. First, it reduces inflammation throughout your entire body, including in your prostate and pelvic region. Second, and this is huge, it helps regulate your hormones, which is absolutely crucial for maintaining a healthy prostate. Think about it. What are the two main reasons men develop prostate problems? Inflammation and hormonal imbalances. And what does vitamin D3 address? Both of these root causes. It's like having a two-for-one solution that tackles the problem from multiple angles. I love this vitamin so much that I recommend it for numerous conditions, and prostate health is absolutely at the top of that list. But before we dive deeper into why vitamin D3 is so effective, I need to share something with you that most doctors won't tell you. The truth about prostate diagnosis that will shock you. Here's something that's going to completely change how you think about prostate problems. Many times, when you're experiencing symptoms that seem like prostate issues, the actual problem isn't even in your prostate at all. Mind-blowing, right? Listen carefully to this. If you have any damage, trauma, muscle tears, or inflammation in your pelvic region, this can trigger symptoms that feel exactly like prostate problems. Your hip joint could be the real culprit. Old injuries in that area could be the source. Any kind of trauma or inflammation in your pelvic region can make it feel like you have prostatitis or BPH, even when your prostate is perfectly fine. And here's the crazy part. Many doctors will prescribe prostate medications, even antibiotics, when you don't actually need them. What you really need is to address the underlying issue in your hip joint or pelvic region, not throw medications at your prostate. So if you're dealing with lower back pain, sciatica, or any discomfort in your hip joint, you need to treat that first before jumping straight to prostate treatments. This is critical information that could save you from taking unnecessary medications with potentially serious side effects. This is exactly where vitamin D3 comes back into the picture. Because guess what? Vitamin D3 doesn't just help your prostate directly. It also strengthens your joints, reduces inflammation in your pelvic region, and helps prevent the wear and tear on your hip muscles that could be causing your symptoms in the first place. The age factor and what's really happening to your body. Now let's talk about something that every man needs to understand. Why do prostate problems typically start as we get older? The answer lies in your hormones, and this is where things get really interesting. In my practice, I've observed a clear pattern. When testosterone levels decline, that's when prostate problems begin. It's not a coincidence. Maintaining healthy testosterone levels is directly connected to maintaining a healthy prostate. They go hand in hand. But here's where it gets even more complex. There's another hormone player in this game called DHT, which stands for dihydrotestosterone. Your body has an enzyme called 5-alpha reductase that converts your testosterone into DHT. And when you have elevated levels of DHT, two things happen. You start losing your hair, and you start developing prostate problems. This is why you see so many older men who are both balding and dealing with prostate issues. It's not two separate problems. It's the same underlying hormonal imbalance manifesting in two different ways. And guess what helps regulate these hormones? You got it. Vitamin D3. This vitamin plays an absolutely massive role in balancing your hormones, including testosterone and DHT levels. It's like a master regulator that helps keep everything in check. The shocking statistics. Every man should know. Let me hit you with some numbers that should wake you up. Men over the age of 50 have a 50% chance of developing prostate problems. That's right, 1 out of every 2 men. And if you make it to 75 or older, that number jumps to 90%. 9 out of 10 men will suffer from prostate issues if they live long enough. These statistics are staggering, but they also tell us something important. This isn't just bad luck or random chance. There's a reason these numbers are so high, and it comes back to what we've been talking about. Declining testosterone, elevated DHT levels, chronic inflammation, and weakened joints in the pelvic region. The good news? All of these factors can be influenced by proper nutrition, particularly by getting adequate levels of vitamin D3. This isn't about treating symptoms. This is about addressing the root causes before they become serious problems. The second critical nutrient you need to know about. While vitamin D3 is the star of the show, there's another nutrient that deserves serious attention when it comes to prostate health. Zinc. This mineral is absolutely crucial if you want to maintain a healthy prostate. Zinc plays multiple roles in prostate function. It helps regulate hormone production, supports immune function in the prostate tissue, and has anti-inflammatory properties. The combination of adequate vitamin D3 and zinc creates a powerful 1-2 punch for prostate health. Think of it this way. Vitamin D3 is like the quarterback of your prostate health team, but zinc is the star running back. You need both working together to win the game against prostate problems. The ancient herbs that modern medicine ignores. Now that we've covered the vitamin and mineral basics, let's talk about some herbs that have been used for centuries to support prostate health. These are powerful natural remedies that have stood the test of time, and the science is starting to catch up with what traditional medicine has known all along. Gokshura, the athletic herb with prostate power. The first herb I want to tell you about is Gokshura, which you might know by its English name, Tribulus. This herb has become incredibly popular worldwide, and you can even find it in sports nutrition shops because athletes use it to support testosterone levels and overall performance. But here's what most people don't know. Gokshura has been used in Ayurvedic medicine for thousands of years, and one of its primary traditional uses was for prostate health. This isn't some new trend or fad. This is ancient wisdom backed by modern research. Gokshura is considered one of the absolute best herbs for maintaining prostate health. The dosage can vary depending on the brand and concentration, so you'll want to read the label carefully and follow the manufacturer's recommendations. But this is one herb that deserves a place in every man's supplement regimen, especially as you get older. You can typically use Gokshura continuously for 3 to 4 months without needing a break, which makes it convenient for long-term prostate support. Pumyamalaki, the gut-prostate connection you never knew existed. The second herb I need to tell you about is Pumyamalaki, and this one addresses something that most people never consider when thinking about prostate health: your gut. Here's a truth that's going to surprise you. If your intestines aren't clean and your gut isn't healthy, the inflammation in your body is never going to go away. You can take all the prostate supplements in the world, but if your gut is a mess, you're fighting a losing battle. This is where Pumyamalaki comes in. This remarkable herb serves multiple purposes. It's one of the best herbs for liver health, which means it helps your body process and eliminate excess DHT, the hormone we talked about earlier that contributes to both hair loss and prostate problems. But that's not all. Pumyamalaki is fantastic for cleaning out your intestines, reducing gas and bloating, and addressing indigestion. When your digestive system is working properly, inflammation decreases throughout your entire body, including in your prostate. The recommended dosage for Pumyamalaki is typically half to 1 teaspoon, taken twice daily after meals. However, there's an important protocol to follow with this herb. Use it continuously for 2 months, then take a 1-month break, and then you can resume use again. This cycling approach allows your body to get the maximum benefit without building up a tolerance. Why your gut health matters more than you think. Let's spend a moment really diving into this gut-prostate connection, because it's something that deserves more attention than it typically gets. Your gut is home to trillions of bacteria, both good and bad. When your gut bacteria are out of balance, this condition called dysbiosis creates chronic low-grade inflammation throughout your entire body. This inflammation doesn't stay localized in your digestive system. It travels through your bloodstream and affects every organ, including your prostate. Additionally, a healthy gut is essential for properly metabolizing and eliminating hormones, including excess testosterone and DHT. If your liver and digestive system aren't functioning optimally, these hormones can build up to problematic levels. This is why addressing gut health isn't just a nice bonus when dealing with prostate issues. It's actually fundamental to getting lasting results. You can't ignore your digestive system and expect your prostate to be healthy. They're too interconnected. Putting it all together, your prostate health game plan. So let's recap everything we've covered, because I want you to walk away from this with a clear action plan. First and foremost, vitamin D3 is your foundational supplement for prostate health. This vitamin reduces inflammation, regulates hormones, strengthens your joints, and addresses multiple root causes of prostate problems all at once. If you're only going to take one thing, make it vitamin D3. Second, don't overlook zinc. This essential mineral works synergistically with vitamin D3 to support healthy prostate function and hormone balance. Third, consider adding gokshura to your regimen. This time-tested herb has been supporting men's prostate health for thousands of years, and modern research is validating what ancient practitioners always knew. Fourth, address your gut health with bhumyamalaki. Remember the cycling protocol: 2 months on, 1 month off, then repeat. This herb will help clean out your digestive system, support your liver, and reduce overall inflammation. The hidden truth about pelvic health. Before we wrap up, I need to circle back to something crucial that we touched on earlier. Remember when I told you that many prostate symptoms aren't actually caused by the prostate itself? This is so important that it bears repeating. If you have any history of injury, trauma, or chronic pain in your lower back, hips, or pelvic region, these issues could be the real source of your symptoms. Hip joint problems can refer pain and dysfunction that feels exactly like prostate trouble. The beauty of the vitamin D3 approach is that it addresses this possibility too. By strengthening your bones and joints, reducing inflammation in the pelvic area, and supporting overall musculoskeletal health, you're covering your bases regardless of whether the primary issue is in your prostate or in the surrounding structures. This is why I always tell my patients, don't immediately jump to aggressive prostate treatments without first ruling out or addressing any hip, pelvic, or lower back issues you might have. You could save yourself from unnecessary medications and their side effects. The bottom line: here's what I want you to take away from all of this. Prostate health isn't some mysterious, inevitable decline that you have to accept as you age. Yes, the statistics show that most men will eventually develop prostate problems, but you don't have to be part of those statistics. By understanding the root causes, inflammation, hormonal imbalances, gut health issues, and pelvic region problems, you can take targeted action to prevent or address prostate issues before they become serious. Vitamin D3 stands out as the single most important supplement you can take because it addresses multiple root causes simultaneously. Combined with zinc, gokshura, and bhumyamalaki, you have a comprehensive natural approach to supporting prostate health. And remember, this isn't just about avoiding problems. It's about maintaining your quality of life, your vitality, and your independence as you age. Prostate issues can be embarrassing, uncomfortable, and seriously disruptive to your daily life. The good news is that you have more control over this than you probably realized. Taking action. Today, if you're experiencing any prostate symptoms, or if you're in that age range where prevention becomes crucial, don't wait. Start with the basics. Get your vitamin D3 levels optimized, add zinc to your regimen, and consider the herbs we've discussed. But equally important, pay attention to your overall health. Address any gut issues you might have. Don't ignore pain or discomfort in your hips, lower back, or pelvic region. These seemingly unrelated problems could be contributing to or even causing your prostate symptoms. And finally, work with a healthcare provider who understands the complexity of prostate health and is willing to look beyond just prescribing medication. Sometimes the best treatment isn't a pharmaceutical drug. Sometimes it's addressing the underlying nutritional deficiencies, hormonal imbalances, and inflammatory conditions that are creating the problem in the first place. Your prostate health is in your hands. You now have the knowledge to take control. The question is, what are you going to do with this information? I hope this knowledge empowers you to make better decisions about your health. Remember, the goal isn't just to treat disease. It's to build and maintain true, vibrant health that lasts a lifetime. Stay informed, stay proactive, and above all, stay healthy. Your future self will thank you for the actions you take today.